10 brain tumor signs you're missing. Are you in danger? Right now, there are 10 warning signs your brain might be trying to send you, and you're probably ignoring every single one of them. In fact, 3 of these signs are so common that 8 out of 10 people dismiss them as just stress or getting older. Here's what most people don't know. Approximately 700,000 Americans are currently living with a brain tumor, and every year, over 80,000 more will be diagnosed. But here's the critical part. Early detection can mean the difference between a 90% survival rate and a 35% survival rate for certain tumor types. The problem? The average person waits 7 to 9 months after their first symptom before seeking help. Now, you've probably heard that severe headaches are the main warning sign, right? That's what everyone thinks. But research shows that only about 50% of brain tumor patients actually experience headaches as their first symptom. The other half? They're dealing with completely different signs, ones you'd never connect to something serious, signs you might be experiencing right now and brushing off. So let's go through all 10 signs that medical professionals say you should never ignore.
This video is for educational purposes only and not a substitute for professional medical advice. Always consult a qualified healthcare provider about your health. All information shared is backed by credible, peer-reviewed research, with links to the original studies in the description.
Sign number 1. Seizures and tumor-related epilepsy. Have you ever wondered why your body suddenly shakes uncontrollably, or you experience strange sensations you cannot explain? Seizures could be your brain's desperate alarm signal. They happen when abnormal electrical activity disrupts normal brain function. Here's what the research tells us. A 2024 consensus review in neuro-oncology found that tumor-related epilepsy occurs in up to 80% of patients with high-grade gliomas. In children with brain tumors, seizures are the first symptom in 13 to 24% of cases. But why do tumors cause seizures? The answer lies in how tumors disrupt your brain's delicate balance. They increase extracellular glutamate, which is your brain's main excitatory chemical messenger. They also alter chloride levels and form abnormal connections between neurons and tumor cells. The location of the tumor matters significantly. Tumors in the temporal, frontal, or insular lobes are particularly prone to causing seizures. Low-grade gliomas and glioneuronal tumors, like gangliogliomas, are especially epileptogenic, meaning they generate seizure activity more easily. These seizures can be focal, affecting just one area, or generalized, involving the entire brain. The encouraging news is that effective tumor treatment often improves seizure control. Complete surgical removal of the tumor is associated with better long-term seizure outcomes.
Sign number 2. Visual disturbances. Your vision could be telling you something critical about your brain health. Visual disturbances are a prominent feature in brain tumors, especially those near the optic pathways. A 2025 study in BMC Ophthalmology found that up to 50% of children with brain tumors experience eye-related symptoms at diagnosis. What exactly should you watch for? Blurred vision is common, but it's not the only warning sign. Visual field defects, where you lose vision in specific areas of your sight, occur in 10 to 25% of cases. One particular pattern is called bitemporal hemianopia. This means you lose vision on the outer sides of both eyes. It happens when a tumor presses on the optic chiasm, where your optic nerves cross. Papilledema is another critical sign doctors look for. This is swelling of your optic disc, the spot where the optic nerve meets the eye. It results from increased pressure inside your skull, pushing on the nerve. Color vision problems can also develop, along with difficulty seeing in dim light. These visual changes sometimes appear before any other neurological symptoms. Early neuro-ophthalmology evaluation is essential because delayed recognition can cause permanent, irreversible vision loss that no treatment can restore.
Sign number 3. Focal neurological deficits and motor weakness. When specific parts of your brain are affected, you develop what doctors call focal neurological deficits. These are weaknesses or problems that affect specific body parts. They often provide crucial clues about exactly where a tumor is located. Motor weakness is particularly common and concerning. Hemiparesis means weakness affecting one side of your body. Monoparesis refers to weakness in just one limb, like an arm or leg. A 2015 review in Neuro-Oncology Practice confirmed that motor deficits can appear at any disease stage. They significantly reduce quality of life and are linked to shorter survival times. So why does this happen? Tumors can directly invade your motor cortex, the brain region controlling movement. They can also compress descending motor pathways, which are the nerve highways carrying movement commands from brain to muscles. Secondary effects like edema, which is brain swelling, or hemorrhage, which is bleeding, can make things worse. The dysfunction may show up as simple weakness, spasticity, where muscles become stiff and tight, or ataxia, which is uncoordinated movement. These deficits often progress over time if untreated. Any new or worsening weakness should trigger urgent brain imaging to check for tumor growth or complications.
Sign number 4. Hearing loss. Is your hearing fading on one side? This could signal something more serious than age-related changes. Unilateral sensory neural hearing loss is a hallmark of tumors in the cerebellopontine angle, a space at the base of your brain. Vestibular schwannomas, also called acoustic neuromas, are the most common culprits here. Over 90% of patients with these tumors develop some degree of one-sided hearing loss. The hearing decline may happen gradually over months, or less commonly, occurs suddenly. The cerebellopontine angle houses several important cranial nerves. These are the nerves that exit directly from your brainstem. When tumors grow here, they compress these delicate structures. Cranial nerve 7 controls your facial muscles. Cranial nerve 8, the vestibulocochlear nerve, handles hearing and balance. Compression of these nerves produces distinct symptoms. Tinnitus, that persistent ringing in your ear, often accompanies the hearing loss. Facial numbness or weakness may develop as the tumor enlarges. Some patients experience diplopia, which means double vision, or dysphagia, which is difficulty swallowing. The mechanism is straightforward, but devastating. The growing tumor squeezes the nerves against surrounding bone. Early recognition is critical because delayed treatment can result in permanent deficits that cannot be reversed.
Sign number 5. Headache. Headaches are incredibly common, but when should you worry? According to a 2024 review in Neurologic Clinics, headache occurs in 48 to 71% of brain tumor patients. This makes it one of the cardinal symptoms, yet it's also one of the most easily dismissed. Here's something important to understand. Your brain tissue itself has no pain receptors. It cannot feel pain directly. So where does tumor-related headache pain come from? The pain originates from pain-sensitive structures around your brain. These include the dura mater, the tough membrane covering your brain. Blood vessels and cranial nerves in the area are also sensitive to pressure and stretching. The classic brain tumor headache is described as severe, early morning pain with nausea. But here's the twist that surprises many people. Research shows this classic presentation is actually relatively uncommon at initial presentation. Most patients experience nonspecific or tension-type headache features instead. The key warning signs are progression over time and worsening intensity. Headaches that worsen in the morning or with position changes deserve attention. Doctors look for red flags like neurological deficits accompanying the headache. New, persistent, or progressively worsening headaches warrant neuroimaging. This typically means an MRI scan to rule out intracranial pathology.
Sign number 6. Cognitive impairment. Are you forgetting things more often or struggling to concentrate? Cognitive deficits affect up to 49% of people with primary brain tumors, according to a 2025 systematic review in Supportive Care in Cancer. These problems span multiple mental domains and profoundly impact daily life. Memory difficulties are among the most frequently reported issues. Patients struggle to remember recent conversations or appointments. Attention problems make it hard to focus on tasks or follow complex instructions. Executive function, your brain's command center for planning and decision-making, often suffers. Language skills can decline, affecting word finding and verbal expression. These impairments hinder social engagement, occupational performance, and personal autonomy. Why does this happen? The causes are multifactorial, meaning multiple factors contribute. The tumor itself directly damages cognitive networks. Peritumoral edema, which is swelling around the tumor, disrupts normal brain function. Seizures can fragment cognitive processes during and after episodes. Treatments like surgery, radiotherapy, and chemotherapy also contribute to cognitive decline.
Left-sided tumors and larger tumors are associated with greater subjective cognitive impairment. The alignment between what patients report and what tests show varies considerably. Subjective complaints from patients are equally important as objective test results. Both patients and their family members often notice these changes before formal testing reveals them.
Sign number 7. Personality, behavioral, and mood changes. Imagine becoming someone your family barely recognizes. A 2023 systematic review in neuro-oncology practice found that up to 67% of people with glioma experience personality or behavior changes. These transformations can be subtle or devastatingly profound. The frontal lobes are particularly vulnerable. This brain region governs personality, impulse control, and social behavior. Tumors here disrupt frontal subcortical circuits that regulate who you are as a person. What kinds of changes occur? Aggression and irritability may emerge in previously calm individuals. Apathy makes people lose interest in activities they once loved. Paranoia and suspicion can strain relationships with loved ones. Disinhibition removes normal social filters. Patients may say inappropriate things or act impulsively without awareness. Emotional lability causes rapid mood swings between laughing and crying. Here's something crucial to understand. Family members often notice these changes before patients do. The person affected may lack insight into their own transformation. Mood disorders are also prevalent in this population. Depression affects 10 to 32.5% of brain tumor patients. Anxiety impacts 30 to 35% of patients, and both conditions correlate with shorter survival times. These changes result from tumor effects, surrounding brain swelling, or treatment complications. Psychological responses to the devastating diagnosis also play a significant role in behavioral changes.
Sign number 8. Language and speech disturbances. When words fail you, your brain might be sending a critical message. Language and speech disturbances, collectively called aphasia, commonly affect patients with tumors in the language-dominant hemisphere. For most people, this means the left side of the brain. A 2025 study in neuro-oncology practice reported that language impairments in glioma patients range from 3% to 61%. The frontal and temporal lobes are particularly important for language processing. Tumors in these areas produce distinct types of aphasia. What specific problems develop? Verbal fluency suffers, making speech slow and effortful. Object naming becomes difficult, and patients struggle to find the right words. Sentence repetition and comprehension can also deteriorate significantly. The mechanisms behind these impairments are multiple. Direct disruption of language networks is the primary cause. Peritumoral edema, the swelling around the tumor, further compromises function. Tumor characteristics matter significantly. Higher grade and more invasive tumors cause more severe language deficits. Slow-growing tumors may allow the brain some time to compensate through neuroplasticity, which is the brain's ability to reorganize itself. These impairments may be temporary or permanent, depending on tumor characteristics in treatment.
Sign number 9. Sensory disturbances and paresthesia. Strange sensations running through your body deserve your immediate attention. Numbness, tingling, and altered sensation are frequently reported in brain tumor patients. These sensory disturbances are particularly common with parietal lobe tumors. The parietal lobe is your brain's sensory processing center. It interprets touch, temperature, pain, and body position. Tumors here directly affect your ability to perceive the world around you. Paresthesia is the medical term for abnormal sensations like tingling or pins and needles. These feelings occur without any external cause. They may feel like electricity running under your skin or ants crawling on your body. A 2025 review in Current Treatment Options in Neurology confirms that sensory symptoms frequently accompany motor deficits and seizures. This combination provides important clues about tumor location in the cortex. The underlying mechanisms vary considerably. Direct involvement of the sensory cortex disrupts normal signal processing. Compression of ascending pathways blocks sensory information traveling to the brain. Edema and ischemia, which means reduced blood flow, create additional problems. These symptoms may develop gradually over weeks or months. Sometimes they appear suddenly and dramatically without warning.
The distribution can be focal, affecting specific body areas, or more diffuse and widespread across multiple regions.
10. Endocrine dysfunction. Your hormones control virtually every body function. When tumors affect the hypothalamic pituitary axis, widespread hormonal chaos ensues. This axis is your body's master endocrine control center. Pituitary adenomas are benign tumors that account for a significant proportion of intracranial tumors. A 2023 JAMA review details their diverse presentations. They may produce too much hormone, too little, or cause problems simply through their size. The symptoms vary dramatically depending on which hormones are affected. Amenorrhea means women stop having menstrual periods unexpectedly. Galactorrhea is unexpected milk production from the breasts in non-pregnant individuals. Hypothyroidism develops when thyroid hormone levels drop too low. Adrenal insufficiency occurs when cortisol production fails. This causes fatigue, weakness, and potentially life-threatening crises during stress. Growth disturbances affect children with tumors in this region. Visual impairment is surprisingly common with pituitary tumors. Between 32% and 70% of patients with pituitary adenomas experience visual problems. The optic chiasm sits directly above the pituitary gland and is easily compressed by growing tumors. Additional symptoms include persistent fatigue and unexplained weight changes. Sexual dysfunction affects both men and women with these tumors. Endocrine evaluation is essential for anyone with tumors in the sellar or suprasellar region where the pituitary gland resides.
If you enjoyed this video, please give it a like and subscribe to the channel. It really helps support the content and make sure you don't miss future videos.